Good evening, ladies and gentlemen. I am Dr. Zhang, a board-certified medical oncologist, and it is my pleasure to be here with you today to discuss a topic that has the potential to reshape cancer treatment strategies: low-dose chemotherapy in gastroesophageal cancer. In recent years, low-dose chemotherapy has emerged as a promising new strategy for cancer control. However, it is not without controversy, as there are ongoing debates about its effectiveness in managing various human malignancies. Traditionally, chemotherapy and surgery, and radiotherapy have been the mainstay in the battle against malignant tumors. The prevailing belief has been that higher doses of chemotherapy yield the most optimized efficacy. As a result, treatment regimens have often focused on administering chemotherapy at the maximum tolerated dose density. However, this approach has been challenged by some clinical trials, where escalating the dosage did not lead to the desired outcomes, but instead resulted in increased severe toxicity, and in some unfortunate cases, therapy-related deaths. Chemotherapy, while effective in targeting malignant lesions, also affects normal tissues, making it a double-edged sword in the fight against cancer. Consequently, many patients have been intimidated by the severe toxicities associated with conventional chemotherapy, leading some to even refuse potentially life-saving treatments. As medical oncologists, we are driven to find optimal treatment regimens that can achieve favorable outcomes with the lowest possible toxicity. This need prompted the exploration of alternatives, and gradually, the concept of low-dose chemotherapy began to gain attention. Today, I will share with you the data and my personal view of low-dose chemotherapy, and its potential impact on the management of gastroesophageal cancer. We will explore the available research, discuss its implications, and shed light on the advancements that have paved the way for this new therapeutic approach. Ultimately, the goal of our discussion is to gain a comprehensive understanding of low-dose chemotherapy, and its role in providing an effective and better tolerated treatment option for patients battling gastroesophageal cancer. So, let us embark on this journey together as we explore the promises and challenges of low-dose chemotherapy in the fight against gastroesophageal cancer. Let us begin by looking at 3 dose levels of the same chemotherapy. Level A, which entails an oxaliplatin and capecitabine combination regimen. In this plan, patients receive oxaliplatin at a dose of 130 mg per square meter on day 1, repeated every 3 weeks. Simultaneously, capecitabine is administered at a dosage of 625 mg per square meter twice daily. Level A has shown promise and has been considered a standard treatment option for metastatic gastroesophageal cancer. Level B introduces a 20% dose reduction in the oxaliplatin and capecitabine combination. This approach aims to balance efficacy and tolerability, ensuring that patients can better manage treatment-related side effects while still benefiting from the therapeutic effects of the drugs. Taking the concept of dose reduction further, Level C proposes a 40% dose reduction, approximately half the regular dose of Level A, making it a much gentler treatment option. By employing a more cautious dosage approach, Level C seeks to minimize toxicity, providing a viable option for patients who might be more vulnerable or intolerant to standard chemotherapy dosages. Throughout medical history, high-dose chemotherapy has been considered the gold standard in cancer treatment, with the premise that higher doses yield better results. However, in this recent study, the outcomes have taken us by surprise. The research has revealed that there were no significant differences between standard high-dose chemotherapy and low-dose chemotherapy, in terms of patient survival and disease control. Remarkably, even the response rates were found to be similar between the 2 treatment groups. As anticipated, one aspect where low-dose chemotherapy truly stood out was in its reduced toxicity. Patients receiving the low-dose regimen experienced significantly less toxicity compared to those on the standard high-dose treatment, indicating a potential shift towards a more patient-friendly approach. These findings have profound implications for cancer treatment strategies. They challenge us to reevaluate the way we approach chemotherapy and prompt us to consider the feasibility of adopting low-dose chemotherapy as a viable alternative to the traditional high-dose approach. This Phase 3 clinical study provides robust evidence supporting the viability of low-dose chemotherapy as an effective option in achieving comparable efficacy to conventional dose chemotherapy for managing malignant tumors. Significantly, the low-dose regimen offers distinct advantages, notably in the form of substantially reduced toxicity, which addresses a critical concern shared by the majority of patients. These findings hold the potential to catalyze a paradigm shift in cancer treatment, fostering a more personalized and patient-friendly approach to managing malignant tumors. The implications of this research are far-reaching. They prompt us to reassess the traditional high-dose approach, and consider low-dose chemotherapy as a potential game-changer in cancer treatment. By striking a balance between efficacy and safety, low-dose chemotherapy opens new doors for improved patient well-being and quality of life during treatment.